What's up everyone, it's Dr. Kells here from Fit Club Physical Therapy and Sports Performance. I'm here with my good friend and buddy Dr. Mohammad from Grand Central Foot Cares. Today our topic of discussion is going to be stress fractures. We see tons of patients who come into our clinic with swelling in the feet and vague foot or lower leg pain, and I'm consistently looking to refer out for a radiograph to clear that patient from a stress fracture. Routinely, those people come back to the clinic and say, hey look, my x-rays were negative and no fracture showed up. So Dr. Mohammad, often when I send my patients out for that radiograph, they come back saying that it's clean and that there is no fracture. Can you please tell the people why that may be?
Sure. That's actually a great question and stout observation. So stress fractures are unique. They actually used to be known as marcher's fracture. What would happen is these cadets, when they would train for the Army, they would put them on these long hikes and they would come back and say, you know what, my foot is pain. It's swollen, it's bruised, and I have pinpoint pain in this aspect. So what they'll do is they'll take an x-ray and they'll say, hey, x-rays are completely negative, stop crying. But in reality, the unique thing about stress fractures, they don't show up on x-ray till about 10 to 14 days after you notice that pain. And that's why it's important to get a clinical evaluation immediately, because that's the clinician saying, hey, it doesn't show on x-ray, but I'm gonna treat you as if it's broken. So what they'll do is they'll immobilize you. They'll put you in a boot and they'll bring you back in 2 weeks' time to do repeat x-rays. And that's the moment of truth. That's what really tell you if it's broken or not broken. And once you do have a stress fracture, unfortunately, we all know bone takes some time to heal. It takes about 4 to 6 weeks for bone to fully heal, and that's in a healthy patient. If you're a smoker or overweight or osteoporotic bone, you might double that. A lot of my patients, which happen to be runners, what they complain about when I diagnose them with stress fractures is, what about my training? You know, they don't want to have that muscle atrophy, they don't want to have that loss of endurance. So although I could put them on a bike or swimming, not everybody has that ability to do so. So today we're actually going to talk about a unique concept that you put me on, known as
BFR. So, Dr. Mohammad and I got to talking, got to chatting about how we can best help those people. And this tool, shout out to Smart Tools for the BFR FDA approved kit we use all the time here at Fit Club. This tool is actually great for runners who have stress fractures. As Dr. Mohammad just explained, you're going to be in a boot, you're going to be in a splint, you're going to be non-weight bearing or partially weight bearing. We don't want you to put all your weight through your legs. What happens? You have muscle atrophy or you lose muscle tone. What happens? You have low bone density, so that when you go back to your activities, there's a risk for recurring fractures. How can we combat that? With BFR. So, what is BFR? BFR is short for blood flow restriction. What I have on my thigh here, my right thigh, is a BFR kit. It has been pumped up, it's filled with air, and it's restricting the blood flow that goes to the rest of my limb. Now, you may be thinking, is that a good thing? Yes, it is. We're restricting the oxygen that goes to our tissues, and that makes our muscles that much more efficient. We have to use less oxygen to achieve the same results, thus making the body more resistant to injury. In particular, with stress fractures, we have insulin growth hormone that is released once we take this medical device. It rushes into the area, and that helps to increase some of the bone density. So, some of the exercises that we spoke about that we like to use for our runners who have stress fractures are as follows. Check them out. I don't have any weight around my leg, and what I can do to make sure that I'm still using my quads and hamstring is a nice straight leg raise. My protocol for my runners, especially my marathon runners who are more into endurance, is 5 minutes on the clock. I want us to do 20 reps followed by a 30-second rest. 20 reps followed by 30-second rest for 5 minutes. Again, we're dealing with endurance athletes here. We have to train your muscles for that sport. Next, we can come onto your stomach and we can do the same thing as far as now working your glutes. Again, 5 minutes on the clock, 20 repetitions, followed by 30-second rest in between. Last but not least, on the table, as far as my straight leg raise series goes, is laying on my side, working now my glute medius here. This glute med lives in this region here, and it helps perform muscle activation, lifting the leg up towards the ceiling. Again, same protocol, 20 repetitions, followed by 30 seconds rest for a total of 5 minutes. There's no weight, there's no resistance, and I don't know if you can get a close-up as to my veins, but because the blood is getting occluded towards this right leg, you can see the difference between my veins on my right side versus my left side. Again, there's no weight. Completely safe exercise and activity for our runners to be doing as they're waiting for that bone to fully heal and to get them back on their course towards that marathon. For more information about BFR, physical therapy, and overall foot ankle problems, keep following us, give us a like, and we'll see you next time.